ask a little bit about insurance, and you've written some interesting blogs recently, which are available on the AEI website, American Enterprise Institute.org. But they're focused on the importance of people keeping their health insurance during this pandemic. And we have an employer-based system, and that means that people lose their job, they often lose their health insurance. So you've talked about different buckets of strategies for maintaining that. One is the expansion, not expansion, but an open enrollment period for the ACA, the Affordable Care Act, which the administration has rejected, but some states are picking up. Another is helping with COBRA, which is I forget exactly what COBRA stands for, but it's a way of people who've been fired or laid off to keep their employer-sponsored health insurance.
COBRA stands for very expensive temporary insurance.
Exactly, something like that. Yeah.
Even better. It's the Consolidated Omnibus Budget Reconciliation Act.
Ah.
Now, if that doesn't flow off your tongue, there's something wrong with it.
Well, and the final one is expanding Medicaid, and there might be some other ones too. But it's really you are no fan, it's fair to say, of the Affordable Care Act. So you're not writing blogs in praise of all that the Affordable Care Act is doing, but you have considered the Affordable Care Act as part of potential strategies for making sure that people maintain their health insurance during the pandemic. Which are your favorites?
Well, absolutely, Bob. Thanks very much also for that plug. This is a crisis. We should be pulling out all the stops. Not necessarily permanently. I'm a big fan of private insurance. I'm a big fan of the kind of financial incentives that lead ideally to efficiencies, to better healthcare at more affordable prices. But right now, the key is to make sure that everybody has insurance. And those who don't have insurance, we should open the door as wide as possible. Now, how would we do that? You raised the point about the ACA exchanges. As you said, a number of states who run their own exchanges have decided to have a new open enrollment period. I would hasten to add that if you lose your job, you kind of already have an open enrollment period in the ACA. But I'm really thinking about the people who were unemployed or for other reasons don't have one of the events that allow them to go back into the exchanges to try to get coverage. Those are the people that I think we really ought to be reaching out to as much as possible, and many of them are actually eligible for subsidies that they may not even know about. Similarly, why not on a temporary basis provide money to the states that haven't expanded Medicaid, again, on a short-term basis, say 2 years, something like that, so that people who would qualify for Medicaid under ACA rules could get it, and why not pay it 95% of the cost for those 2 years? And then we could rethink all this once the crisis is over. But there's a public health reason to do this, which is that if you have insurance, you're much more likely to have a doctor that you can contact electronically. You're much more likely to contact a physician before you get extremely ill. You're much less likely to go to a hospital or go to an emergency room unless you absolutely have to under these circumstances.
I was just going to say that, and the whole point is until we get the virus under control or some semblance of control, we can't go back to normal. So it's kind of like an all-in approach right now. Fix the healthcare issue first before you can fix the economic fallout.
Yeah, that's exactly right. I mean, it's social distancing, and most people realize that one of the places they want to be as far from as possible is the hospital emergency room. But that doesn't mean that they don't have healthcare needs that need to be seen on an urgent basis, just not there. And insurance would open the door for a lot of people to go after that, to do what they should do.